everything we're going to be going over is going to teach you more about diabetes, ways in which you can help your body to undo some of the things that have caused it, and just give you a much better understanding of what you can do to help your body to, let's not say get rid of diabetes, you can't really get rid of it, but you may be able to make your life, depending on your particular form of diabetes, so that you don't even know it's there anymore. And that'll depend, and listen and learn, and we'll start.
David, before we begin discussing all the important ways that people can help to address the diabetes, I'd like you to cover the different types of diabetes first.
In general, when medicine talks about diabetes, they talk about either type 1 diabetes, which is also called insulin-dependent diabetes, which is also just referred to as very often childhood diabetes. There are a bunch of different terms. And type 2 diabetes, which is most often referred to as adult onset diabetes, because it's not something, this may change as people continue to eat worse and worse all the time, but it's not something that you're born with. And the biggest differences as far as what you all need to know, you being the people that are watching the video, is that the type 1 diabetes is more of a, if you get it from birth, which you may not. You may develop it as you get older. But if you have type 1 diabetes from birth, then it's obviously going to be genetic. Anything that you get when you're born, that you already have when you're born, had to have been genetic. However, if you get it later during life, there are all sorts of possible reasons that things that will assault your pancreas, that will prevent your pancreatic tissue from doing what it's supposed to do. We know a number of them, including different toxic chemicals, viruses, possibly parasites. And the medical profession says we have to use insulin in order to, I don't want to use the word combat that. It's not, you're not fighting against it, but in order to bring the insulin in that your pancreas is not producing. And then we have type 2 diabetes, which is adult onset diabetes, and that's a misnomer because today our children are eating so poorly that very often we could call it child onset, not at birth, because then it would be type 1, but that they get it in at a much younger age than they should because of eating so badly, so quickly. But we do still consider it to be adult onset diabetes. It usually happens sometimes in 40s and 50s, although many, many more people are getting it much, much younger. And in that condition, diet can have a huge, huge effect, although it can have an effect in both.
Well, since type 2 diabetes is caused mostly by food choices, does that make it the easiest to correct by changing to more appropriate food choices? And are all healthy foods good food choices?
That's a good question, especially the question, are all healthy foods good choices for diabetics? And no, they're not. Because there are a number of foods that would otherwise be referred to as healthy, which would still turn to sugar so quickly that they would be very unhealthy for a diabetic. So let's see, the question is it easier to address? Yes, it is easier to address. And will diet be able to address most of it? Yes, again, the majority of type 2 diabetes, adult onset diabetes, is addressable by diet. And we're going to be going over what some of those diet changes are, although not in tremendous depth. And as far as that last question, which we should really spend a minute or so on, would I be able to say that if you have a healthy food, then it's going to be fine for a diabetic? Absolutely not. Because, for example, there are a number of foods that I would consider to be very healthy, which would include a whole bunch of different fresh fruit, as long as people don't eat too much of it, or whole grains such as millet, and these are some grains that you may not know, you the audience: millet, amaranth, quinoa, teff. Most people are more familiar with rye and wheat and barley. And grains turn fairly quickly into sugar in our body. That's one of the things our body does with them. So a whole grain, let's say a 100% whole wheat piece of bread, which might be perfectly fine for some people in moderation, not the amount of bread people eat, but otherwise, but might be a horrible thing, or a bowl of pasta, a horrendously horrible thing for a diabetic, whereas a healthy person that has a bowl of pasta, as long as there's adequate amount of good quality sauces on it, large amounts of meats, good quality amounts of fats. That might slow the conversion of the pasta, which will turn into sugar, enough to make it okay, not for a diabetic. The diabetic would actually be best avoiding as much flour as possible, no matter what type of grain the flour was made of. And even whole grains, limiting them would be helpful for a diabetic. And they should really only eat the super concentrated healthy grains, most of which you may never heard of, such as teff, quinoa, and amaranth. And there is one grain that has been shown to convert into sugar in your body more slowly than all the other grains. That grain is barley. And so, although you may never have had barley, except possibly in some cream of barley soup, I highly suggest that you try a couple different varieties of barley. There's a white barley, a black barley, a buffalo barley, and use that as one of the grains if you want to throw a grain, let's say, into a soup or stew. That would be a lot healthier for you. So there are definitely foods that in general could be healthy for people that maybe should be avoided by the diabetic.